Facial masculinization surgery is a set of procedures to masculinize the face. In interpersonal dynamics, people will assess the face for masculine features to gender an individual. The surgery for facial masculinization seeks to augment the features of the face that will gender the face as more masculine. In doing so, we're really looking at things such as the eyes, the brow ridge, the nose, and the jaw, and how all of those features come together harmoniously for a masculine countenance. When I meet a patient for facial masculinization surgery, I'm taking a look at the face on a whole. Before anything, I like to take in the proportions of the face, the upper third, the middle third, the lower third, and look at the relative relationships between the eyes, the nose, the mouth, the jaw, and how all of this fits into the overarching facial proportions. Specifically, I'm looking at the bony development along the forehead ridge, as well as the nasal proportions along the midface. Lastly, I'm looking at the angles of the jaw and how strong that bone appears. Creating a more masculine countenance involves creating accentuated features that speak to larger bone mass than what is frequently seen in feminine faces. And in taking that into account, I can start my surgical planning. When it comes to the surgical intervention for facial masculinization surgery, I typically start with a facial CT scan. The facial CT scan is important for two reasons. One, it allows me to look at the bony anatomy and the craniofacial skeleton of the face. Secondly, it allows me to do pre-surgical planning and design implants that are specific and unique to each of my patients. When evaluating the face and performing the surgery, usually is broken up into thirds: the upper third, the middle third, and the lower third. For augmentation of the brow ridge, the incision is placed along the hairline and is hidden there. With that incision, I'm able to access the frontal sinus and the bone along the forehead and place the patient-specific implant, secure it there with titanium plates and screws, and then close the incision in a way that's easily camouflageable. Next, there are modifications to the nose that can make it appear more masculine, as the masculine nose is generally larger, less dainty, and with different proportions than the feminine nose. There are procedures within plastic surgery that can alter these proportions and alter the angles to create a more balanced profile. Lastly, it is important to think about the jaw when we're considering facial masculinization surgery, as the overarching goal is to create some more angles to the face, a stronger, more masculine countenance. And for that, jaw implants are typically part of the equation. These implants are placed from within the mouth so that the scars can be fully hidden, and the implants again are designed for the patient specifically. Lastly, when we're talking about the Adam's apple can be enhanced using cartilage from the patient's body or from off-the-shelf products. Scars are an inevitable part of surgery. Thankfully, many of these scars can be camouflaged or placed in locations that are difficult to see. For facial masculinization surgery, we are talking about scars along the hairline, the shadows of the nose, and inside of the mouth. The recovery for patients differs depending on the surgeries that are performed, but typically patients are counseled to leave about 2 to 4 weeks off from heavy activities or from work. During that time, patients are counseled to apply ointments to their incisions, to use medical-grade mouthwash, and to really keep activity levels at a minimum. There can be a lot of swelling associated with surgery. That swelling does mitigate at around 2 to 4 weeks, and you can usually go to the grocery store without people knowing that you've had surgery at around the 2 to 3 week mark. For all the swelling to resolve, we're talking about 6 months to a year, really depending on your own anatomy and your healing process.